So I haven't posted a testosterone update or pretty much anything except for like 2 covers in the last few months. Sorry about that, I've been really busy. Yeah, this is my 1 year post-op video, which is pretty crazy because it's just gone so fast. So I've got a Q&A, which I'm going to do, and then obviously I'll show you my chest and all that fun jazz. Yeah. So the first question is, how was being post-op? Like, was it uncomfortable? Was it painful? So when I first woke up, I didn't actually realize I'd had surgery. I kept trying to sit up and like get out of bed. I don't know why I thought I was in hospital, but I just didn't realize I'd had surgery. So this nurse kept having to run over to me like, you need to lie down, you need to lie down, you've had surgery. And I was like, I'm fine. So when I first woke up, I literally wasn't in pain, wasn't uncomfortable. I was trying to use my arms and stuff. It was a bit of a nightmare. Once I'd kind of come round a bit, I felt really sick. So the nurse helped me sit up in a chair, threw up a couple times. It was a pile of fun. When I got back to my hotel, I was just like, I'm going to sleep now, night. I couldn't fall asleep because I felt so sick. So in the end, I had to like make myself throw up because I was not going to be able to go to sleep until I'd thrown up everything that needed to be thrown up. I also, I kept trying to eat, but I couldn't actually like stomach anything, so I just had this one singular strawberry. I think I've got a picture actually, I'll put it in. And then I just went to sleep and I was fine. Next day I woke up, no pain. Like the bandages were a bit tight. Apart from that, I was literally fine. I went for a walk with my dad. I had food. I was completely chill. By the second day, the bandages started to really annoy me. They were really tight, really itchy. It was horrible. I went around Walmart. I was going around shopping centers. I bought this t-shirt from the shopping center on my second day post-op. Yeah, I was literally fine. The third day was awful. I don't know why, but I felt really sick again. Everyone was like, oh yeah, the pain meds make you feel sick, but because I wasn't in any pain, I wasn't taking the pain medication, so why was I sick? I don't know. Yeah, it was annoying. Threw up some more. It was great. After that, fine, literally fine, no issues whatsoever. Except for the bandages, because the bandages, well, I got used to them like being really tight, but they were so itchy and you're not allowed to like loosen them or take them off or anything. So I was dying. I literally resorted to like sticking a plastic knife down the bandages and like itching, especially on my back, because it was just so itchy and so horrible. The drains were absolutely fine. Literally couldn't even feel them. The second question is, did you struggle with anxiety or depression through the recovery? No, literally not at all. I kind of prepared myself for post-op depression because I already struggle with depression, so I was like, this is not going to be fun. But I was quite busy. I went out on walks with my dad. We went on a boat trip, like a little speedboat trip. We went shopping. I was completely fine. I could do anything. Anxiety, I just wasn't where I honestly, the second I woke up and I'd realized that I'd had surgery, it was just like everything's just been lifted off my shoulders. I had no issues. I was so calm and just chill and just happy. The third question is, can you ask for a specific shape for the incisions to be? I didn't ask my surgeon for a specific shape because I love the way that he does his incisions. Like, they're perfect in my eyes. Not every surgeon has the same like incision technique and stuff. I know a lot of the surgeons in the UK have more like curved incisions. Personally, I didn't like that. That's why I went with Dr. Garamoni, because his incisions are very straight and then like curved up. You know what I mean? I would say that if you're going to a surgeon, you should probably trust the technique they use. So if you want your incisions a specific shape, go to the surgeon that closely matches that shape, because otherwise, if you're not 100% happy, then it's not going to be that fun. Fourth one is, have you got bottom surgery? No, the surgeries are separate. I just got the top surgery done. I don't want the bottom surgery right now. Fifth question is, oh my fucking god. The fifth question is, one thing nobody tells you about surgery. To be honest, everything's really out there. There's not like a big secret that nobody talks about. I mean, I think if you're gonna have surgery, you should have done a lot of research, and I don't think there's anything that you won't be able to find out about through research. If you have a specific question and nobody else seems to be able to answer it, I'll answer it. I don't mind. Just DM me on Instagram. Sixth question is, what was the hardest part about top surgery? The hardest part was by far the itching and the bandages. One of the medications I take for anxiety is actually an antihistamine, which is supposed to stop itching or at least help, and it was still horrendous. So I don't even want to think about how bad it would have been if I wasn't taking those meds. Seventh question is, do you still need a referral to go overseas for top surgery? It depends who your surgeon is. Dr. Garamoni requires one physical clearance letter, basically saying that physically you're fine to have surgery, and one like more mental health clearance, I guess. I just got both of them signed by my GP because it just needs to be by a doctor. It doesn't need to be by a psychiatrist or a gender identity clinic or whatever. 8th question is, how much did my top surgery cost? So the whole thing, including Dr. Garamoni's fee, the hospital fee, the anaesthetic fee, all that jazz, came to $8,125. When I looked at it a few months ago, with the exchange rate it was at the time, it was just over £6,000. Are we on 9? We'll just say 9. The 9th question is, how long did the pain last after surgery? Obviously, I've already said I wasn't in any pain. I could do pretty much everything for myself after about 3.5 weeks. After 6 weeks, I was like completely fine, back to normal, no issues whatsoever. 10th question is, how come I didn't get peri or keyhole? Quickly, if you don't know what that is, double incision, obviously like I had, they make 2 incisions here, pull everything out, put your nipples back on, done and dusted. With peri or keyhole, they make like a small incision around your nipples and then kind of pull everything out from there, mostly using liposuction. Most surgeons, the cut-off limit to have that is a small B cup, purely because if you're that size or bigger, they might not be able to get all the tissue out, and obviously it wouldn't look very good if you still got tissue left. So basically, I was actually a small B at the time I was having surgery. So I was kind of thinking to myself like, oh, maybe I should inquire about peri and keyhole and stuff. But then I was just like, what is the point? Because I was never that bothered about my scars or how they were going to look. I just wanted my chest to be flat. That was it. So I was like, why would I bother risking having peri and not have a completely flat chest, rather than just having a completely flat chest and then having scars? Because scars don't last forever, like they're gonna fade. So that was my decision. I didn't even bother asking my surgeon because I was like, what was the point? The 11th question is, what hospital did you have your surgery at? And I actually just have to Google that real quick because I don't remember. Great, Google, you were so helpful. Thank you for giving me the answer. Yeah, so Google doesn't have the answer, but off the top of my head, it was called like the Memorial Day Center or something. I can't remember. So the 12th question is, did anybody tell you surgery was never going to happen, and how did you deal with that? In my head, I was telling myself this is never going to happen, never going to happen, never going to happen. I guess like dealing with timescales, the way I always thought about it, and the way that really helped me was, obviously when I had surgery, I'd literally just turned 18 like the month before. I was only dealing with dysphoria for about 5 years, which isn't that long if you think of the next like at least 60 years I was gonna spend in the body that I always wanted. So my thought process that just helped me through it was, in 10 years that waiting is going to seem like nothing, like it's going to be nothing. But that was just my thought process. I don't know if that's going to help anybody else, but that's just how my brain works and how my brain thought of it, I guess. So the 13th question is, did going privately cause issues with you and your gender identity clinic? Well, I was never with an adult gender identity clinic because I saw the under 18 clinic, Tavistock, and they were assholes with me. They were just shit. So I said to them, I was like, I'm going private, and they were like, we strongly disadvise you to do that. I was like, that's fine, I don't really give a fuck what you say. Goodbye. Number 14 is, were you afraid of not liking the result? Yes and no, I guess. I had full faith in Dr. Garamoni, my surgeon, because a lot of people don't like this, but this is something that I really like about him. All of his results are so similar, so I knew that mine were going to look like the thousands of other people's chests I'd seen that were done by Dr. Garamoni, and they look amazing. So I was like, well, I'm not going to be upset with my choice of surgeon or anything like that. Was worried about whether I'd be self-conscious about the scars, because as much as I didn't care about whether I had scars, I have anxiety anyway, so obviously walking around shirtless with 2 massive scars across my chest would probably send my anxiety straight through the roof. So I was worried about that. And the only other thing I was worried about is if my nipples rejected or got infected and whatever, or one fell off, I don't know. Basically, I wasn't worried about anything except for having a complication and the anxiety about my scars. But My nipples didn't fall off. Yay. I've just been in Spain for 2 weeks. We went to a water park, we were on the beach. I had my shirt off and I was completely fine. Like, obviously people were staring. I was expecting people to stare. But I don't really care that much. I mean, if someone's being like really obnoxiously rude and staring, I'm like, really? But if someone's just having a look, I'm like, obviously that's human nature. People are gonna look and are gonna wonder, and that doesn't actually bother me. I really thought it would, but it genuinely doesn't. Final question, number 15. How has your life changed after surgery? This is the big one, because since having surgery, my life has just like got infinitely better. Before I had surgery, I was going home early from college after having a mental breakdown, or just my mental health was too bad to continue with the day, at least once a week, if not two. Dysphoria was through the roof. I couldn't cope with anything. I couldn't get a job because my anxiety was so bad. My college work was not fab because I was struggling. My whole life was just, it wasn't good. I didn't see my friends very often. I didn't have many friends. Now, I went back to college after I had surgery, and I actually started speaking to people that I wanted to be friends with in my class. After surgery, I was like, fuck it, if I want to be people's friends, I'm just gonna have to talk to them. So then I started talking to them, and wow, look at that, now we're friends. I actually want to see and hang out with my friends. I have a job, like that's the big one, and my job is a swim instructor. So obviously I could never do that before surgery, and now I can. College, I think I went home like twice early this college year because I just didn't need to. I can order my own food, I can make my own phone calls, I can answer the front door, and all these things sound like things that just humans do, but I couldn't do it, and now I can. So it's like it's just this huge life-changing thing. Like, that's my favorite part about top surgery. It's just completely reshaped my life into the life that I've always wanted, because before I really wanted it and I felt like I just couldn't quite get it, and now I've got it because I felt like I could after the confidence that surgery gave me. Okay, I'm just gonna put in some comparison and like timeline pictures. So, as you can see, I have some acne, thanks to testosterone. Around the sides, the scars are actually starting to fade, especially on this side a lot. I've got a little bit of chest muscle, not a lot. But yeah, it's completely flat. I've got all my sensation back around everywhere. My nipple sensation is... Sorry, that just felt really weird. Nipple sensation is coming back slowly. Like, I can... Hang on, what can I poke it with? I was just gonna pick up some scissors and poke it with a scissor. How stupid can I get? I'll do it with my car key. Healing wise, I still get like occasional like shooting pains, but they're not like bad shooting pains. It's just like a quick like... I don't know how to explain it, but it's just like a quick like sharp pain, and then it's gone like by the time I've noticed it. And that's literally just nerves reconnecting. So that's it. I have nothing else to say except for if you need any advice, or you have any questions or anything like that, then just DM me on Instagram, and I always answer everyone. It's in the description. I keep going to say bio, it's not bio, it's a description. Are they the same thing? My 1 year on testosterone will be up next month. That's exciting. And yeah, see you soon.